We're here to talk about your product line, Sente.
Yay, I'm very
What it
excited.
does so well in our office.
Yeah, thank you for for having us and inviting us to talk about our technologies. I'm really excited to hear your questions, especially.
Right now in wintertime, I kind of expected this, but we're selling a lot of the Ultra Nourish. Everyone comes in saying, I am so dry, what can I do? And so far I've just found that that's a product that seems to, even though it's a little pricey, people really come back loving it and are buying it again.
Yeah, I mean, it is, it's perfect for this time of year. And I think even last year when we launched it, we kind of knew that that's probably when we would see another pickup on the product just during the winter, the very dry skin. It had done really well throughout the year in like higher elevations where it's always like colder and drier. But in the winter everywhere, I think it's really performing incredibly well because it does have that nice surface moisture to add to everything else that it does.
Right.
So how do you guys know when to suggest dermal repair versus the Ultra Nourish dermal repair?
Yeah, so we look at them as, is your skin dry or is it very dry and needs more surface moisture? Dermal repair cream, we do talk about that being for people that have like sensitive skin, sensitized skin, maybe that have that visible redness that just won't go away. It's also safe for pre and post microneedling and non-ablative laser. Dermal repair Ultra Nourish is for people that, even with dermal repair, still say the surface of my skin is dry. I need more soothing. I need more moisture on the surface of my skin. It's that patient with the very dehydrated skin. It is also great for people that have visible redness, have sensitive skin. It's also tested pre and post laser and microneedling. So it has some similarities to dermal repair cream, but the big difference is, are you dry or are you just very, very dry and sensitized?
I also think dermal repair is good for people who just really do have a little bit of sensitivity. They tend to say things just irritate their skin, but they just don't need that much, heavy moisturizing.
Yeah, I think that's a really perfect way to put it. Dermal repair definitely has, to me, dermal repair has more of a soothing quality to it than dermal repair Ultra Nourish, because I think dermal repair Ultra Nourish is that inverse emulsion that kind of breaks on the skin a little bit. But dermal repair cream, it's just a nice soothing cream that has more of a surface soothing experience, where dermal repair Ultra Nourish has a surface moisturizing experience. So we really do, it's good to hear that you see it the same way, because we really do see that dermal repair cream is ideal for people that need more soothing for their skin, that everything burns, everything irritates, no matter what I do, my skin is still irritated. That's the dermal repair cream patient.
What do you think about setting up a pre-treatment regimen for patients, whether it's for microneedling or for laser treatment, ablative laser? Are there products that suggest themselves in the Sente line better for pre-treatment rather than post?
Definitely. And I think it depends on what you're treating for, right? Like what is the concern that we're trying to correct? But definitely in all cases, we look at hydration. The skin, if it's hydrated, is always going to tolerate a procedure better, whatever that procedure is. Of course, your laser treatments target water in the skin, so it's ideal to have as much hydration in the skin as you can get. If it's microneedling, same thing. It's going to pull water from the skin. Your skin will be drier after the treatment. So what can we do to elevate the hydration levels in your skin before you have that treatment? And in all those cases, it's dermal repair cream or dermal repair Ultra Nourish, just to get the skin back to normal, is what I like to say, is to bring it back to this baseline where you do feel like it's time to treat the skin, to help alleviate excess dryness, to help alleviate excess irritation, and to get the skin back to a place where it's comfortable to treat it with that procedure. It will tolerate the treatment well and have a better result. So I would always prep with dermal repair cream or dermal repair Ultra Nourish. Again, is the patient dry or incredibly dry and sensitized? But then also, outside of that, what are the other concerns we're trying to address? So if it's not a laser treatment that you're having, and you have fine lines and wrinkles, you have loss of elasticity, then you build a regimen that treats those concerns as well. I think when we talk about like building a regimen around a protocol, there's two different things that you're looking at. It's what do I do to get the skin ready for the treatment, but then also what are the concerns I'm treating and how can I address those with the regimen? So if a patient is coming in for loss of elasticity, fine lines, wrinkles, hyperpigmentation, I want to treat all those concerns with the regimen while preparing them for the treatment. So that's where it might be dermal repair cream with one of the retinol products, either BioComplete serum or intensive BioComplete cream, to help stimulate cell turnover and to address some of the other concerns that they have in their skin. While dermal repair cream is, soothing the skin, raising hydration in the skin and getting them ready to tolerate the treatment better. Obviously, if they're having a laser treatment, they would be stopping their retinol at some point leading up to that based on your recommendations. They can continue using their dermal repair cream after the treatment, and then they would go back to their retinols after, whenever the doctor says that it's okay to return to that. But in all cases, we've done a study with dermal repair cream before Fraxel Dual, and we know that, you raise the hydration levels, you bring the skin back to homeostasis, back to balance, and you have a better experience and you have a better result.
Well, it looks like you've been doing something with your beautiful skin here on camera. So I got to hand it to you.
Not really.
You talk a little bit, because I know patients want to hear, like, what sets Sente apart? What puts it on the map? And like the science behind the heparin sulfate analog and kind of these analogs that.
I think obviously it's our analog, right? Like you just said, heparin sulfate analog. We do have the patent on that. It is in most of our products and it's in all of our treat products. And it is the thing that we're the only brand in the country that has in our skincare products. We have the patent to put it into topical skincare products that can be used for skincare purposes. Heparin sulfate analog is an analog of heparin sulfate, which is a naturally occurring molecule in the skin. Heparin sulfate in your skin is one of the glycosaminoglycans that hydrates in the skin, but it protects the cell surface from inflammation and from the destruction that is caused by inflammation. We know that endogenous heparin sulfate in your skin is responsible for creating this nice little cocoon, right? A safe place for every single cell in your body, every single cell in your skin. Keeps it hydrated, helps it communicate with the cells next to it, helps it bind proteins for future use. But what is most important, we know, is that heparin sulfate protects your cells from damage caused by inflammation. Let's say that you've lost some heparin sulfate off of your cell, then you essentially have an opening on the cell surface for cytokines and other things that come along with inflammation to attack the cell. By having a cell that's completely protected with heparin sulfate, you're protecting those cells from the things that happen during inflammation. So what HSA does is to mimic that entire process to protect the cells, just as if they are completely coated and protected by endogenous heparin sulfate, to keep them from sustaining the kinds of damage that are caused during inflammation.
So it's kind of a protective envelope, isn't it? Yeah. One of our scientific advisors says, think about it like the rainforest, like that canopy over the rainforest. You have this lovely canopy of trees that covers the entire rainforest, protects it from things getting in that would damage the rainforest, but also holds the moisture in and holds in all of the life that lives in a rainforest. Think of heparin sulfate, and heparin sulfate analog is performing a similar function to that.
I have a couple questions. Are the other analogs also patented and unique to Sente?
Yes, sir, they are. The DSA and the CSA, they are all patented and proprietary to Sente, used in our products.
I kind of find that being able to acknowledge that to a patient, I think kind of piques their interest in products, right? To say, hey, there are only a certain number of products that actually have a patent on them. Otherwise, any company in the world can actually use these ingredients and kind of create their own recipe, and there's nothing unique other than their recipe.
I agree.
A couple questions I've had that I've kind of said, I'm not sure, and you can tell me, where do you think the retinol and BioComplete serum fits in the strength of retinols, Retin-A or Tret of some sort? I mean, where do you think that kind of strength lies? Because a lot of people have said, is that retinol enough for me? Do I need TRET as well?
Right, that's a really good question. We know that the composition of BioComplete serum it's a total of 1.1%. It's a 0.1% retinol, and then a 1% retinol sulfurate, which is a retinol ester that converts 2 times to make retinoic acid. So when it all converts down, we see that it's equivalent to about a 0.02, a 0.02, a 0.025 TRET. Right, so very gentle. Let's say it's at the lower end of very gentle, the lowest strength of tretinoin. You add that to hyaluronic acid, you add that to heparin sulfate analog, you're getting the benefits of all 3 of those ingredients in the formula. It is a very gentle formula. If you can use it every day, is there more benefit to that than there is to using 0.1% TRET once a week, right? Or is there more benefit to that versus using something stronger that you can't tolerate and not being able to use it often enough? I believe so. Like, I believe that you need to be using whatever retinol you choose for your regimen, you need to use it every night to get the benefit. And you haven't optimized your routine until you can tolerate your retinol every night, whether that's BioComplete serum, 0.025 TRET, or that's all the way up to, 0.5% retinol, 1% retinol, or the highest tretinoin. I feel like until you can move all the way up that scale, you could still make progress in your regimen, right? So BioComplete serum being at the lower end might be as much as someone can tolerate. So let's say you have a patient that has very thin, very sensitive skin. Maybe they're older and they've spent most of their life in the sun and they didn't take care of their skin. And you can see that they have that very thin, upper layer of skin. You can see the loss of elasticity. You see the loss of hydration in their skin, but you want to be able to give them the benefits of a retinoid. BioComplete serum may be all they can tolerate as far as a retinoid. And if they can use it every single night, they're at least getting that consistent dose of something that is equivalent to 0.025 TRET, which is very helpful for them versus nothing at all. They might find that they can move up some point to a 0.5% retinol, or to even a 1% retinol. But for me, and I think for us, it's what can you tolerate every day? That is going to make the biggest difference to your skin. If it's BioComplete,
do you agree with
right?
that?
If it's
the constant dose.
I think just constant application is the key, and not to expect overnight results. It's just the consistent use. Other question comes up, and again, it's hard to assess when you look at the label, but people say, is the HSA the same concentration in every product?
Yeah, so it's the same in BioComplete serum, dermal repair cream, dermal repair ultra nourish. It is different in some of the other products because chemically it had to be different, right? It's different in dermal contour press serum because we couldn't get all 3 of them in the formula at the same concentration that HSA is alone, right? And that's the chemistry of really any product, is which ingredients will fit in what percentages into a formula and play nice with each other. So it's at its highest in BioComplete serum, dermal repair cream, dermal repair ultra nourish. It's different in dermal contour press serum, but you have to remember you have DSA and CSA in dermal contour press serum, and those are very important in protecting the collagen and elastin ends from degradation, helping to pack and bind that very neat, orderly, dermal structure. So those add to anything in dermal contour press serum that we may perceive has been taken away by a different level of HSA.
And then staff, because they're kind of out there at the front lines kind of selling products, is a question I get very frequently is, if I were to recommend just one Sente product, which one would I recommend? And I don't think you have any comments on that.
Yeah, for me, it's either dermal repair cream, dermal repair ultra nourish, right? Going back to pick your dermal repair, right? That's what we say, pick your dermal repair. Are you dry? are you very dry and very sensitive? And it's one of those two to start, because you can add that into any regimen and you'll just see the improvements. You'll see the increases in hydration. You'll see the improvements in the visible redness. You will see the improvements in less sensitivity, but it doesn't have retinols in it. So you don't have to worry about sliding it into a regimen that already contains a retinol. It's just very easy to add to a regimen, very well tolerated. To me, like kind of levels up your skincare regimen just a little bit when you add it in, and then you can build the regimen from there.
What do you guys say to people about the penetrability of the active ingredients like the HSA? How do you know you take it on faith? How do you know it gets through the skin and does the job that your endogenous HSA does?
Right. So, that's a really good question. In topical skincare, you can't really say that things penetrate, because that's a drug claim, right? And then you become a pharmaceutical. So, we say absorb, and we do know that, and I think there's also a question around penetration versus absorption, right? Absorption is when, to me, something sinks into your skin on the surface of your skin and you no longer feel it like sliding around the surface of your skin. Absorb is an experience. Penetrate means the ingredients are going to where they need to go. We know through clinical studies, especially one published in the JDD a few years ago, that heparin sulfate analog does get to where it needs to get, in the epidermis, in order to make the difference that it makes in the skin, and mimics that state of having all the heparin sulfate that you need. And we know that because we can measure transepidermal water loss. We can, measure the increases in hydration. We have measurements in redness that show decreases in inflammation. We have some other data that shows, upregulation of hydration in the skin, improvements of hydration on the skin. We have measured with cutometer, elastometer. We can see the improvements in the elasticity and the firmness of the skin. So in most situations, right, you don't actually measure, is there more HS in the skin? You know what conditions you should see in and on the skin that would indicate that the product is doing what it needs to do. And we know, right, we measure for all of those, and we know that we see the improvements in hydration, the improvements in barrier function, the improvements in the appearance of lines and wrinkles, the improvements in firmness, measured and visible. So those are the things that we would expect HSA to do, and we've measured for all of those and can see that it is indeed doing that.
I have a question, because we're doing just a lot of fractional laser resurfacing. I mean, the easy ones are like Clear and Brilliant, but a lot of LaserMD, Moxie, kind of mid-range treatments, and then Halo, and then even up to Profrax. And there are products that we certainly have learned that you don't put on freshly fractionated laser-treated skin because it burns.
Yes.
And so of all these products in your line, which would you say would be the first go-to product that someone could probably handle? Maybe not that day, but just within 24 hours.
So that's a good question. We have tested dermal repair cream and dermal repair ultra nourish after non-ablative laser, and we know that you can use either of those on the first day and within the first 24 hours, definitely with non-ablative laser. I know, anecdotally, I know that I've used it right after non-ablative laser. Clearly in a lot of practices, it's used right after non-ablative laser. I think when you get into the ablative, partially ablative, fractionated ablative, we say we wait until the skin is reepithelialized. We would not use it until it's at that point, and until you say, right?
That I just say, until you have an intact barrier, most of these products have ingredients that just will sting and burn.
Yeah, absolutely. And so until the barrier is intact, to me, it's still just some very benign, like Aquaphor, or something that just forms that barrier. And then once it's intact and you've seen them back in the practice and you know that they're safe, then I would go to dermal repair cream.
Which of the products would offer pigment challenged patients any relief? Because we're talking about inflammation and rosacea, but anything for pigment, and then also follow-up question, any iron oxides in any of the products to offer any sun protection?
Yeah, so those are really good questions. we know that inflammation leads to hyperpigmentation in certain skin types, right? Once you get past the very fairest of the fair, then we're looking at inflammation that obviously at some point leads to hyperpigmentation in the skin. We have a product called Cispra. We love the product. It contains cysteamine. It's a 5% cysteamine stabilized in the formula. It works very differently to most other ingredients on the market. It helps to start to downregulate that inflammatory process in the skin that upregulates excess melanin production. It causes an endogenous antioxidant response in the skin. It makes your skin release its own glutathione. So if you have glutathione, which we know is a great antioxidant for hyperpigmentation, if you can upregulate the amount of glutathione in your skin, starts to control that inflammatory process in the skin, that therein starts to downregulate excess redness, excess inflammation, and then starts to downregulate the excess pigmentation as well. So Cispra is a brilliant product for hyperpigmentation. Doesn't contain anything that causes exfoliation. It doesn't contain anything that causes sun sensitivity. It's very well tolerated by people that have dry skin, sensitive, sensitized skin. We also did a study with Cispra coupled with dermal repair cream, again, right? Because we know that dermal repair cream is increasing hydration, controlling inflammation, and sort of offsetting any irritation that was already taking place in or on the skin. So those two together make a very nice regimen for controlling inflammation, restoring hydration in the skin, restoring barrier function, and then starting to downregulate that whole process that causes hyperpigmentation. So those two together, great 1-2, for hyperpigmentation. And then to your question about iron oxides, our Invisible Shield SPF 52 tinted sunscreen does contain iron oxides. Obviously, iron oxides are used for color in sunscreen. It's always going to be the tinted sunscreen. But the other great thing about iron oxides is that they offer protection from visible light, which is very important, we know, in triggering that process in the skin that upregulates hyperpigmentation as well. So, both of our sunscreens are actually fantastic for protecting from the entire spectrum of environmental concerns, because they have, the highest UVA rating, PA++++. They have a biosaccharide ingredient in them called Pollution Shield that kind of traps the particles from pollution on the surface of the skin, which is interesting because it actually keeps little particles that float around in the atmosphere from causing irritation on the surface of your skin, which is something that I was not aware of until we formulated that product and put in Pollution Shield, right? The little particles in pollution get on your skin, just sit in your pores, just right on the surface of your skin, and create just a little more irritation just on the skin surface.
That's just a Southern California problem. Northern California problem.
Up there, it's perfect, right? Like pollution.
Pollution, what's that?
We don't have that. Yeah. But to me, that was a really interesting concept, right? Because I always thought sunscreen, makeup, my makeup's going to catch anything that flies by in the air, and I'll wash that back off of my face. But there's actually a technology in ours that kind of, takes care of that a little bit more. We have a blue light filter with Withania somnifera, which is ashwagandha, which is an adaptogen that helps, again, protect the skin from blue light. So it's really a nice, well-rounded environmental protector of UVA, UVB, infrared, pollution, blue light, visible light, all of the things that cause inflammation in the skin, that starts that free radical cascade that causes some kind of damage in your skin.
What do you have to tell us about this the Illuminae Eye product? Here we go. Let me pull it up. There you go. That's one that's actually quite popular among patients in here. That it's a high kind of repurchase rate. Patients return for this product.
What do they like about it, do you think?
I think they like the application of it, the way their under eyes I think they like the fact that their under eyes appear brighter after sustained use of the product.
Yeah, that's what we like about it as well. It was formulated for all of the colors that contribute to those dark circles in your eye, in the eye area. It was formulated to take care of the blues from the vascularity the reds from like broken capillaries, inflammation, irritation, and to also help with the browns, the actual pigment that causes hyperpigmentation in the eye area. So if you can address red, blue, and brown, then you get a better result in improving the dark circles around the eye. So it does that very well. It has heparin sulfate analog in it. It has just a nice blend of botanical ingredients that just support HSA in doing what it does, right? In helping to rehydrate the skin from the inside, control the inflammation in the skin around the eyes. And then you start to see that improvement in redness, the improvements in the blues and the vascularity, the improvements in the surface pigmentation. And that's where you get that end result of that very just bright, fresh eye area that looks just more awake, more alive, well rested, fresher and more even all the way around. It is a lovely product. It is just as popular for us as it is in your practice. And I think the other really appealing thing about Illuminae is that it's less than $100. And for eye creams, we're at a point now, in the market where there are very few really well-made, good eye creams that actually achieve what you want them to achieve that are less than $100. So to me, it wins on all of those points. It hydrates, it brightens, it plumps the skin back up from the inside. It gets vastly improves all of the dark circles in your eye area. And as if that was not already enough, it's less than $100.
Yeah.
What a wrap up.
Yeah.
Hey, we are going to be getting back to our afternoon clinic, but we wanted to say thank you so much for our partnership with Sente. We certainly enjoy and recommend and are heartily behind the line of Sente products. Dr. Swingle,
Oh yeah.
You talk to patients all the time.
Okay. I talk about my company's from Carlsbad, and that's where the technology is. So you guys,
that's where it all is, apparently, right?
Yeah, it really is.
Where the smart people are. No, we appreciate y'all so much. You're just so lovely, and I hope to see you in person soon. But just appreciate all of your support and the fact that we know that you talk about us in your clinic and recommend us to your patients all the time.